Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 306,468 confirmed cases of COVID-19 in Canada and 96,745 cases in Ontario. Chatham-Kent has 466 cases and Sarnia-Lambton has reported 387 cases. Michigan now has 272,034 cases, with 17,752 cases being in Detroit. Today we are reporting 19 new cases of COVID-19 in Windsor and Essex County. 8 are close contacts of confirmed cases, 1 is a local healthcare worker, 1 is community acquired, and 9 are still being investigated. We have had 3,139 cases since March. 2,873 cases are now resolved and 189 cases are active and being followed by our health unit. 13 people are currently in the hospital and 4 people are in ICU. Our community has lost 77 people to COVID. 54 deaths have occurred among residents in long-term care and retirement homes. There are currently 3 long-term care and retirement homes experiencing a COVID-19 outbreak. There is 1 outbreak in the agri-farm sector and 1 community outbreak in a post-secondary student residence. Last night, we reported our first outbreak in the school setting. We are working closely with the school and the school board. Windsor Regional Hospital has arranged for dedicated testing for this school at the Met campus. Students and staff at Bagley School will be able to walk in. The COVID-19 Assessment Center is located in the Emergency Department parking lot at the Met campus. It will be open today from noon till 7 p.m. and Thursday and Friday from 7 a.m. to 7 p.m. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick. Limit the number of contacts you have. Keep a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering if you cannot maintain a 2-meter distance from others. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. Download the COVID Exposure Alert app at canada.ca. Testing is available by appointment at selected pharmacies and assessment centers. Please call in advance to book your appointment and determine your eligibility. Windsor has 2 testing and assessment centers, Windsor Regional Hospital, Olette Campus. If you would like to access the Olette Campus Assessment Center, you must book an appointment either online or by calling 519-973-4443. There's also testing at Erie Shores Healthcare in Leamington and SOHAC in Windsor for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wechu.org for further information and updates. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us again. As cases in the community continue to rise, we are now experiencing cases spilling into other sectors such as long-term care home and more importantly in our school system. Last night we declared an outbreak at one of our area schools. 3 staff members became positive for COVID-19 within a reasonable time period to suspect transmission at the school. As a result of further investigation, we felt it is necessary to err on the side of the caution to protect all our children and dismiss the entire school to break any chain of transmission. The entire school right now is considered high risk for exposure to COVID-19, and the Windsor-Essex County Health Unit is working closely with the school and the Greater Essex County District School Board administrators to manage the outbreak and to further limit the spread of infection and to ensure ongoing measures are maintained to protect the students and all the employees. The school will be sending all parents and guardians a notice about the outbreak, which includes additional public health guidance. It is essential for all staff and students to self-monitor for COVID-19 symptoms every day. And if you have any symptoms, go get tested. And testing is also open for all staff and students if they want to go for testing. And Teresa's already given some instructions on how to get tested if you are a student or a staff worker at the school. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Today we'll start with CBC.
Yes, hi, Dr. Ahmed. I'm just wondering, how many resources do you think it's going to take to manage this school outbreak and to do contact tracing for it?
So right now, as we mentioned, we have 3 staff members that are identified as confirmed cases at this time, and our team is already on top of these individuals to identify close contacts of these 3 people. When we are saying everyone is identified as high-risk close contacts, so obviously that doesn't mean that we will be reaching out to each and every one of them to do further contact tracing. The idea is they will self-isolate for 14 days, just to make sure that none of them develop any symptoms. And because of the concern that the transmission happened at the school, it would be very difficult to pinpoint where exactly happened. And people who are symptomatic, obviously, when we start to get the results, that would trigger further investigation on those specific individuals, not only for the school, but outside of the school system as well. At this time, the focus is to work with the school to contain it from the school setting perspective, and those who are already identified as positive. The rest of the individuals, they are given the letter from the health unit with clear instructions of what to watch out for, how to monitor your symptoms in languages that these students and these families speak. So it's available in multiple language, recognizing that the school has a diverse need for different languages. So we are working closely. So far, we are able to manage it within our staffing at this time. And knock on wood, we don't want to see more cases, but if needed, then that will be a further discussion. Our team is already working really hard to do all the case and contact management from the cases that we have. And as you remember, in the last week or so, we already had more than 150 cases. And the team is really busy, but obviously this is also our priority, and we want to make sure that everything is done to limit any further spread of transmission.
And given that students are cohorted or grouped together and their movements in the school are limited, why are they all considered high risk at this time?
So one of the reasons that, as I mentioned, is the staff piece, that the staff are obviously moving in different, going to different places in the school. And also when you can pinpoint any particular event that maybe because of this activity, the transmission happened, it's a much easier decision. So if you have a staff which do not have any obvious reason for acquisition outside of the school environment, and all they know is there are some evidence that yes, there are other cases in the school system that are positive, but the inability to pinpoint exactly how the transmission could have happened. So based on that absence of information, we felt that the story, the timeline, the epi-link, when we are always doing time, place, and person, these all matched. And we took that unprecedented step of dismissing the school cohort and calling it an outbreak, because there may be other cases as well. There are also concerns about who's the index case, where is it, how did it came. So we cannot pinpoint that based on the investigation that we have done so far. So in the unlikely event that there may be cases or there may be people who are positive who don't even know their status. So we would like to make sure that with this effort, even if there are cases, if they are positive, it does not result in further transmission. And the recommendation for everyone to go and get tested is also to identify any additional cases. If we get additional cases, maybe that would give us more information to better paint a picture of how these transmission happened and how it all started. But at this time, in the absence of information, we felt that it is important to break the chain of transmission in the school and to protect all the vulnerable by dismissing the entire school.
Okay, thank you.
Any questions from Blackburn?
I know you said that testing is available for anyone who wants to get it, but generally what is the recommendation? To wait to see if you do get symptoms or to get tested right away? Could you get tested too soon, perhaps?
Well, when we're talking about the period of infectiousness, I think it's the exact timeline about the known case when they were school. It was mentioned in our media release, and I believe it was the last day was close to November 12th. So even if you go, we're already 5 days in, and so some of them may already start to show symptom. And as I said, we don't even know or we cannot confirm who the index case was. So at this time, especially for the staff, I think it's the right time to go and get tested, and even for the students to go and get tested, because the timeline is where we may expect to see cases, and if early detection of case, we can do a better job. But again, many will be not exposed, and many of these tests will be negative. That's the hope. But the timing is now, and as soon as someone develops any symptoms, I think that's obviously a trigger, even if they're contemplating whether they should go or not. The slightest moment that you feel that you're developing symptom, go and get tested. Meant for everyone else who are concerned, I think based on the availability of the testing is available, dedicated timing today, tomorrow, and the day after tomorrow. So I think it's a good opportunity for people to use that and go and get tested immediately to know the extent and take action at the right time.
I know for privacy reasons, you're not telling us which grades these teachers taught or these staff members were involved in, but have parents been notified? Are there anyone that's maybe a higher risk grades, classes that are cohorts that are higher risk than others in the school?
Well, as we know that there are a number of measures that are already put in place by the school board to protect the children by having the staff wear the appropriate PPE when they're interacting. So based on that, even from that perspective, if we go with everything happened correctly, then there shouldn't be any high risk transmission happening at that place. But not knowing where it happened, how it happened, so it would be very difficult to say one particular grade is impacted more than the other. I think the risk is spread pretty much everywhere, and that's why we don't want to get into the specifics of where exactly the transmission happened, for both reasons, for privacy as well as maybe not being accurate in terms of who the actual risk, high risk people are.
Okay, thank you.
Any questions from the Windsor Star?
Yes, good morning, doctor. When you say you cannot confirm who the index case was, that means that you don't know which of the staff members initially brought COVID into the school?
Yeah, because I think what happens is when we're investigating, so obviously we're trying to find out, okay, where the possible acquisition happened. So let's say if I'm a staff member and if I contracted COVID and I'm not even going outside, so technically maybe I've contracted either at the school or in a place where I don't even know. And in the absence of that, how can I say that I brought it inside the school, or maybe someone else brought it and then passed it on to me? So those are the reasons that we cannot say who the index case is. And when we're talking about expanding the investigation, that's one of the reasons to do that, to flag this for others who may be the index case. Maybe someone else is the index case, and after this initiative, they may consider going and getting tested. And then if we interview them, maybe we may get some better sense of maybe if that was the individual, they had an earlier symptom onset date, maybe mild enough that they ignored it, they didn't bother going testing, things like that. So I think that's why the investigation comes in very handy. And at this time, based on the information that we have, I cannot say that, yes, this is a confirmed known case who acquired it outside of the school environment, brought it to the school, and then passed it on to some other staff member or student, and that's how it started to spread. So we don't have that information.
And then when you said you don't know how it happened in terms of transmission in the school, that means the public health unit can't pinpoint a time when these staff members were unmasked or too close together. It's just you can't identify where they contracted it from one another?
That is correct. So it's a combination of both, that there are some events when you could reasonably think that the staff were together. And obviously, in theory, they should all be having all the appropriate precautions in terms of physical distancing and the masks and everything else. But there may be instances where that may not have been followed. There may be instances that there may be some other type of informal interaction happened that maybe they don't remember, they don't recall. So that's why some of these things gets really challenging to pinpoint, to say where exactly the transmission happened, but recognizing that the large exposure, the possibility of large exposure, it is important that we treat it as a widespread risk, and that's exactly what we did.
And finally, were any of the 3 individuals infectious while they were at the school? I mean, not infectious, symptomatic, excuse me.
Yes, they were, and that's why they were immediately, when we're talking about symptomatic, when we're talking about infectious periods, so I think the infectious period is more important. When even before the beginning of the symptoms, we go back 48 hours before the onset of symptoms. And obviously many of these staff, they have to do their screening too, and they are picked up. Sometimes they show late symptoms, but based on our investigation, they were at the school during their infectious period.
Okay, and sorry, just to clarify, some of them may have had symptoms at that time?
I cannot confirm at that time, like right now, but we can definitely do that. But what I can say is they were there during their period of infectiousness.
Okay, thank you.
Any questions from AM800?
Dr. Ahmed, just following up on Taylor's question. So would those 3 be classified as still under investigation, or would that be considered community, or is it still too early to say?
Well, if we don't have any obvious source to link, so they will be classified as community at this time, but the investigation is ongoing. So let's say down the road, based on our investigation, we are able to link them with a case, and then that would be reflected as it is in our case and contact management investigation or guide that we use. So sometimes even when we are reporting these linkages, that who are who, it can change, and based on our investigation. So when we provide our epi summary, that is the most up-to-date information that we have, and that also includes some of the other people that we report every day that are currently under investigation. So at the moment the investigation, we have some information, we put it in our case and contact management information system, and we report it every Friday as part of our epi summary to include everyone with most up-to-date information.
Can I ask why an outbreak wasn't declared on Monday? Because if I'm not mistaken, the public board released the first case on its website on the 12th, and then on Monday, they released the second case. And was it too early to link them all together to declare an outbreak on Monday?
Well, I think what I can say is when we had the second case, when we were investigation, they were under investigation, the concern was maybe they could have like totally unlinked cases. And because obviously there was no obvious connection with the third one, when we received, obviously that just raised concerns that something is going on. And then when we further investigated these cases, we felt that there may be a possible connection and a transmission source. And then we started to look at it from an outbreak perspective, and that was the appropriate time to declare it. We had our staff have been working. I think last night all of us were here until 9 o'clock, and to clarify all that details, make sure that we have got everything right, and we felt that when we had the information, we immediately declared it. That's why you got some of you got the media release late last night, but we felt that it's important, it's urgent, that it has to go out to make sure that no one is at the school today.
Not sure if you can answer this, but these staff members, if they are teachers, were they teaching students? Or the reason I'm asking, because if it's a virtual classroom, the teachers still have to go inside the building. So does that maybe show that if a teacher's teaching virtual, they should stay at home and teach instead of going inside the building?
Well, I don't want to comment on what the school board thinks. We are not educators, we're public health. I would leave that decision and understanding to the school board themselves to figure out what's the best way to educate children. So I am not in a position to comment on that.
Okay, thank you.
Any questions from Radio Canada?
Yes, thank you. So, Doctor, you mentioned earlier the language barrier and the resources that are available in the community. So is it possible to have maybe more information about that? Have resources been available since the beginning of the pandemic? And from your point of view, is this a central issue specifically in the region?
Well, we do have information translated and available for the major languages that are spoken in our region. With this particular school, we went into the specific demographic for that school, and some of the material that we are trying to make it available to cater everyone. So this is a very targeted one, but all of our resources, we have translation available in all the major languages: English, French, Arabic, Spanish, and other language. Like you can go into our website, but also on our website, our team has done an excellent job in terms of using a tool which is called, I think, Audible, right?
Browse aloud.
Browse aloud, and that helps to do some of that translation services as well. But yeah, we do take that very seriously to make sure that the information is available in the language that these people need, and we do our best to make it available for them.
Okay, and based on that, do you plan to maybe collect socioeconomic data to make sure that the needs of the community are properly met?
Yes, we do, because we have some of our data from our population health assessment and the community needs assessment. We collect that information. We have all that information, that what are the most commonly spoken language in our region, and we do that. And as part of the enhanced data collection that's been happening through the province, some of these additional information are also collected and used to inform us for our decision making.
Thank you.
Any further questions from CBC?
Yes. Do we know if these staff members have attended any other schools, or is the health unit investigating that at this time?
I can answer. At this time, the staff members are dedicated to the school that's been impacted.
Okay, and given that this is the first time an entire school in the region has been dismissed, how does the health unit feel about this? Are you guys prepared and confident to deal with this outbreak?
Sorry,
We're just deciding who's. So I think, again, like from the beginning, our protocols and our collaboration with all of the school boards, has been really quite detailed, and we have been communicating quite well together. So as we've had isolated cases in the schools, we've been prepared that an outbreak just requires 2 cases that are linked, or where there's a possible acquisition through the school. So I think we were prepared. We worked quickly with our staff, with the school board, and also with our communications department, and then with Windsor Regional Hospital for the testing. So I would say that we are as prepared as we can be. I think one of the issues was the fact that it is we live in a diverse community, and we want to ensure that everyone has the correct information and a language they understand. So while we do have some materials translated already, and we actually have some nursing staff that speak multiple languages, that we wanted to make sure that we have some more information translated into other languages. But overall, the school has worked very quick. The school board has worked very quickly to notify the parents of the students and the staff members as well today. Any people that were not able to, that didn't get the message or, continued to go on to school today, our staff were there with the school board staff to help support those parents and students, and to provide further information. So that's ongoing. That they had an early start date this school, so our staff were there very early today, and we continue to work with the school board to make sure there's no other information that's needed or anything that we've missed. So I think it is an outbreak. I can understand that parents are very concerned, And really, it will be important for them to, isolate their children for the next 14 days. And again, like Dr. Ahmed said, get tested. We are recommending testing, but if they do have symptoms, definitely get tested. The staff should be getting tested, and call our health unit if there's any questions. But we want to support the parents. We know it's very concerning for them, and that they might have a lot of questions. And the one question we continue to get is, if I'm the parent, am I, at risk? So the parent is not at risk. They're a contact of a contact. So the children will be deemed high-risk contacts. That's why they're asked to isolate and to self-monitor their symptoms. The parents or any other caregiver is a contact of a contact, and they're not at risk. So that's a question we continue to get with all of the school cases. So just to clarify that.
Okay, thank you.
Any further questions from Blackburn?
No, thank you.
Windsor Star?
Just to clarify again what a high-risk contact means, does that mean that children cannot go outside of their homes?
Yes, so the high-risk contact would be that you're isolating in your home away from others as much as possible, recognizing these are children. But again, there's information on our website, and we're giving parents information about how to do that, not sharing, cups and utensils, and trying to have a separate washroom, clean in between people using the washroom, ensure the child has a separate room if that's possible, but try to maintain a distance at this time. So the child is asked to self-isolate, and that means staying home, not going out and about. The family members, the contacts of the contact, can go out and about, but not the actual contact.
Okay, thank you.
Any further questions from AM 800?
Teresa, it's not a guarantee that the school is going to reopen in 14 days, right? It all depends on if more positive tests come back.
You're correct. We will be monitoring and managing the outbreak, but it could be 14 days. It could be longer. Based on Dr. Ahmed will be the one that rescinds the outbreak, but it really will be based on any further transmission and any of the high-risk contacts becoming actual cases.
And then one more for Dr. Ahmed. Dr. Ahmed, just in regards to today's cases and the number of individuals in hospital, obviously it jumped from Monday's numbers with individuals in hospital and ICU. I know I asked you this on Monday, but how is this impacting our hospitals?
Well, I think purely from a hospital perspective, they would be in a better position to answer that. But from our public health perspective, we do feel that that's the typical path that happens. So when you're looking at the hospitalization as an indicator, it's a lagging indicator. So whatever has already happened in the community, and then they end up in the hospital system. So we kind of expected that when your cases in the community starts to go high, then we're expecting that it would result in more hospitalization and more people in the ICU. So seeing 13 people in the hospital overall, with 4 of them in ICU, that's remarkable, because I think we need to go back and look at how we have dealt with the initial phase of the pandemic and how many hospitalization and ICU admissions we have seen. It is a concern, and I cannot remind it again and again. I know there are messaging out there which tends to undermine the risks and concerns with this virus. Those are all misinformation, and I cannot repeat it again and again. This is a serious illness. This is causing people to die. There are millions of people who are already passed away in this world as a result of this pandemic. And ask someone who has lost a loved one to understand how much an impact it is in their life. And for people who they're saying that, it's just a mild illness, I think they're basically being insensitive to the people and to the lives that are lost. And we get it. We get all the other social, economic concerns of everyone. We get it. Each one of us get it. But we really have to set up our priorities as community, as a nation. What do we want to do? Canada has done an excellent job compared to many, many countries of the world in terms of managing this pandemic. We're coming closer to possibly an end of the pandemic as we're hearing more and more about the vaccines and how effective these vaccines are in these initial trials. The approval processes have started. The planning process has started. So it's not going to stay here forever. And we just need to make sure that even in these times, we know what our priority is, how we are prioritizing our community and health and well-being of everyone, including our elderly, seniors, children, everyone. And we all have to be in this together to understand the pain and sufferings of everyone, even including those who probably have been impacted by it, either through a job loss or through other reason. We get it, but this is the time to act together. This is the time to work together. We know that if we don't take these public health measures, things are going to get worse. Look at what's happening in Europe right now, wide-scale lockdown happening everywhere. The question is, do we want the same to happen here right now? Can we avoid it? I still feel that, I still think that yes, we can avoid it locally if we stay true to what is being recommended and follow all these measures. That's the only way we can avoid it. But in the worst case, if it continues to spread, we are putting ourselves at a risk of another widespread lockdown, which would be very, very challenging, very difficult for many people in many people in our community, both from a social and social well-being, but also from an economic well-being perspective. So I cannot emphasize that, when you start to see these people in the hospitals and the ICU, it's a danger sign, and we need to act right now.
Teresa, just a request for Friday, please, if possible. I know last Friday, Dr. Ahmed said basically zero tolerance. The health unit was bringing down the hammer when it comes to different organizations, businesses. Can we get an update to see if any businesses, individuals have received any fines? I believe the last number was 2. Can we get an update on that, please, on Friday?
Sure, that sounds good. We'll get that for you.
Thank you.
Any further questions from Radio Canada?
No, thank you.
Okay, thank you, everyone.
Thank you.
Thank you.